Look, thanks Chris and Mary, and first of all, I'd just like to appreciate the press being here. I mean, in the give and take and back and forth of politics, it's easy to get distracted and forget what's important. And there's nothing more important for our state and all of our people and our working families and small business and job creation and bringing down the budget deficit than getting our healthcare system right. And if you forgive me, I'm going to go on a little longer than I do just to make the case that this is the type of real reform that we think gives us the best opportunity to get our health system right. And I am proud to be here, right here with the Community Health Center, because I do believe, Mark, that you've got the future right here. Looking at the health IT, looking at the prevention, looking how you deal with your families over a generation. This is what we ought to be. This is what the state ought to be. Let me just say, we have put together this plan carefully over the last couple of years, not just because I was running for governor, but as a professor at Central Connecticut State. We tried to get all the major stakeholders together in terms of coming up with a real healthcare plan. We had labor and business. I was there with Chris Donovan a couple years ago, supporting the pooling bill, giving us a chance to buy into a larger pool with group purchasing. Brian Petronella, labor, right here, a strong supporter. Working families know the importance of what we got to do. The business leaders have been on board. The legislative leaders have been on board. The doctors and the nurses. If you want to get real healthcare reform, you have to have the people responsible for the implementation involved from day one. And I'm so proud of the efforts that the Speaker and the legislature have taken the lead in terms of sustenance and making sure that that's a platform that gives the Connecticut the best opportunity to take full advantage of the healthcare reforms coming out of Washington, D.C. So we've had a collaborative approach, everybody at the table, all the stakeholders. I'd like to mention just a couple of those folks. One, a guy named Mike Critelli. Mike Critelli, at the time when I was working with him, was the chairman and CEO of Pitney Bowes, now retired. One of the most far-sighted and entrepreneurial healthcare plans for the employees of Pitney Bowes, actively involved as we put together our plan. And he said, and I quote, "Good health is good business, and Ned's health plan and the collaborative and thorough approach by which he developed it demonstrates that he understands the strong focus of making people healthier and the commitment to driving economic growth. Working collaboratively with the business community, working collaboratively with the labor community as well is so important. Somebody who's been actively involved as we've been trying to put together this plan really over the last couple of years is a good friend of mine named Sal Luciano. Sal, many of you may know, is executive director of the state employees. And you look at where the high cost of government is, bringing down the high cost of government is going to involve working collaboratively with our state employees to make sure we can bring down those costs and improve outcomes for all of our employees and all of our families. And Sal said, and I quote, actually he quotes Walter Cronkite. Walter Cronkite once said, that's the way it is, "The American healthcare system is neither healthy, caring, nor a system." Could have said the same about Connecticut. Ned has proposed a true system that is both healthy and caring because it focuses on prevention and is evidence-based. And Sal concludes, "It will achieve better outcomes while also reducing costs." And this is how Mary and I mean to govern, and this is how we mean to get real fundamental reforms. Get those stakeholders to the table, labor and business, Republicans and Democrats. We're going to come up with a healthy, strong system reform that brings down the high cost of healthcare. And we've got these charts here because somebody said, "Ned, why do you spend so much time talking about healthcare?" It's like asking Willie Sutton, "Why do you spend so much time talking about banks?" Well, that's where the money is. And I just show you here, we're facing a $3.5 billion budget deficit. And you may see probably one of the biggest buckets of costs that we have that we've got to streamline. We've got to make better for the patients is Health and Human Services, about 42% of our entire budget. And of that Health and Human Services budget, you see about $7.9 billion of that is related to healthcare. And it just gives you an idea that if we're going to bring down the budget deficit in the state, we're going to have to work collaboratively and strongly when it comes to healthcare reform. I'm also a strong believer in public transportation, and I'd like to tell you, look, I know about health care. I know that some people are talking about reducing rates, reducing fees to doctors. That's not the right way to go. Others, the governor talked about cutting visits to a dentist for our poor kids. That's not the right way to go. One of the candidates for governor on the other side of the aisle said, why are we providing insurance for wigs for kids with cancer? That's not the right way to go. Mary and I have a very different plan. We've worked with all the major stakeholders here in Connecticut. We've also found best practices for around the country, ways that we can dramatically bring down those costs. For example, if we paid about the same amount per patient, per Medicaid patient, as they do nationwide, that would represent hundreds of millions of dollars of savings to the Connecticut taxpayer. How do you do that? It's not simply throwing more money at the situation, but it's the fundamental reforms that can make a difference. You know, UConn aging has made a big difference when you look at nursing care. You look at the fact that Connecticut, more than just about any state in the country, is more likely to send our parents and grandparents for a nursing home, when in many cases they would get better care, as Mark and I were just talking about, with more home health care options, with telemedicine, an occasional nurse being able to visit, and give them community-based alternatives. I think that's better for mom and dad, and also has the opportunity to save us up to $900 million a year over the next 10 or 15 years. If we do just what the other states do, have 3/4 of our seniors more likely to be at home and less likely to be institutionalized, real savings there. HIT, Health Information Technology. As many of you know, I've spent most of my life, professional life, in information technology. And it's remarkable to me how antiquated our system is. You know, we were just talking about the Medicaid applications and how labor intensive that is, and handwritten multiple times, and the number of errors that may be as part of that. And then it's faxed to somebody, then couriered to somebody else. It could take days or weeks to do, cost extraordinary amount of money. And the most important thing in health information technology is not just the waste, but to make sure we have coordinated medicine so we know all the meds you're on, all the procedures you've had. And as Rand has pointed out to us, that has the potential to save the state of Connecticut, hundreds of millions of dollars. And that's what Mary and I are going to do. Pay for results, a bundled payment system, no more fee for service. That fee for service system is costing us a fortune and gives a lot of our folks the wrong incentives. A bundled payment like you're seeing at Geisinger, like you're seeing at Intermountain, perhaps like you're seeing in some of our community health centers where folks are on salary. A bundled payment, so for that, cardiac, treatment, you have a set payment. So you have an incentive to make sure you don't have to be readmitted. So you have an incentive to make sure we do it right. So you have an incentive to do the right number of treatments and tests up front. The possibility to save real money for the state of Connecticut and provide better service for all of our patients. And finally, and nobody knows this more than you do here, primary care, prevention, and being there not just when you're sick, being there when you're just okay, being able to come in on a timely basis, as you were pointing out, Mark, being able to come here, on a short-term, near-term basis, just when you need that type of help. Making sure that we have primary care really at the point where the patient might be. At Harding High, where I used to teach, or at Pitney Bowes, where Mike Bertelli made sure that they had a clinic right there, on site. That's the type of prevention we need. Give people incentives to have those checkups. Margaret and I were just talking about some of the incentives you have here, where you maybe get a coupon, a gift coupon, if you go and do all the necessary checkups, or prenatal or such. We've suggested a $50 savings bond if you're an expectant mom doing what you need to do. More prevention, less emergency rooms, less specialists, less costs, prevention. That's what our plan is all about. I'll just tell you that the healthcare reform coming out of Washington, D.C., the monies they've got for those states that are fleet of foot, ahead of the curve, ready to go in health IT, in terms of medical homes, in terms of prevention, in terms of bundled payments, that's going to go to those states that are ready to take advantage of those programs. And I would wager to you that there are going to be states that are winners, and there are going to be states that are losers. States that get it right, in states that fall behind. And Mary and I, we're going to be leading a state that gets it right, gets ahead of this curve. And I know a lot of folks are saying, boy, it's a high mountain up there. I'm not sure we're going to be able to get there. We're just a small state. It's all uphill. Our population is getting older. We're going to have 40% more people over the age of 65 in the next 15 years. How are we going to keep up? Oh, it's a long climb. We're ready to sprint to the top of that mountain. I'm ready to see Connecticut get to the top of that mountain first. I'm ready to see Connecticut take the lead on this. I'm ready for people around the state to say, when I talk about best practices, I'm looking at the state of Connecticut. I'm looking at the extraordinary advantages we have right here. Not just the centers that you see that are so innovative, but you see Yale, New Haven. You see UConn, an expanded UConn system. You see the payer network there in Hartford, the insurance capital of the world. You see the financial community in other parts. Tripling the funding for Connecticut innovation. Give our small, mid-sized businesses the incentives to grow and expand. Connecticut is going to be at the forefront of this healthcare revolution. We have all the wind to our back. We have the advantages there. We have the best trained workers, the best trained scientists in the world. There's no reason that made in Connecticut for the 21st century is going to be life sciences, biotech, and delivery of healthcare for all of our citizens. So I'm positive about running up to the top of that mountain, and I hope you are as well. And I look at innovative programs like this, and I know what an extraordinary difference it can make. Look, this is the state that brought us, Eli Whitney, Igor Sikorsky. Well, look, we're going to also be the Eli Whitney of healthcare systems. And we're going to be the Igor Sikorsky of medical devices and new biotech. We are going to be a leader here. That's why I'm spending this time. It's not only that we have an opportunity to dramatically bring down costs and make our state more efficient, but really bring our state into the 21st century. It's better for our patients, it's better for our parents, and it's going to be better for our state when we get people to work again. Thank you, everybody.